Hi everybody, I'm WSAV.com Now reporter Ashley Williams. I'm at the Coastal Health District this morning. I'm speaking with an expert about the latest on the coronavirus and what you need to know. I'm here with Dr. Lawton Davis. He is the District Health Director for the Coastal Health District, and he's going to be answering a few of the questions that you have had about the coronavirus outbreak and how it is impacting our community. So thank you, Dr. Davis, for joining us this morning.
Thank you for having me.
So the first question I want to ask you this morning is about what the Coastal Health District is doing to ensure the people in Savannah are safe amid this outbreak, especially, we keep hearing about cases every day across the country.
Right now our efforts are focused primarily in two areas. One is assisting the State Department of Health with surveillance, looking to see what's happening in various communities, and the other would be communicating with our local partners to be sure they have the latest information and are prepared to respond. At the state level, epidemiologists work with health providers and hospitals to identify cases of COVID-19, isolate those cases, and then reach out to people who may have come in close contact with them with a confirmed case, and our epidemiologists here would do the same thing at a local level. At the same time, we remain in close contact with our local leaders in our community. We share information from the Department of Public Health and from CDC, everything about how schools might prepare, what event organizers can do to lessen the risk of illness, what hospitals and healthcare providers need to know. And we also talk with the media to try to disseminate factual, up-to-date, current information.
And speaking of factual information, can you talk about some of the misinformation that's been floating around out there regarding COVID-19, and also just kind of talk about the facts that people should know about those?
We often hear people say things like, we know there's a confirmed case at hospital XYZ or in a certain county because they heard it in a restaurant or they think they overheard something in a doctor's office. I can assure you that when we have our first case of COVID-19 in a resident of Chatham County or in any of the other 8 counties in our health district, we will make a public announcement. This is not something we're trying to hide. And also, some people now think that with commercial testing available in locations, that they might be able just to walk into a private lab and have a test done. That is not the case. All the tests still need to be requested by a healthcare provider. A couple of the funnier rumors we've heard would include things like this virus targets people of certain races or ethnicity. I can assure you that someone of Asian descent is no more likely to contract this virus than is anyone else. You do not contract this virus because you eat in an ethnic restaurant. And then finally, the best one of all is that you can't get this virus by drinking Corona beer.
I've heard that one a lot as well. So, if someone were to experience symptoms related to the coronavirus, can you talk about, how soon they might actually start experiencing those symptoms after possible exposure, and also, what symptoms might they want to look out for?
Sure. Based on what we've learned from similar viruses and so far in the history of this illness, symptoms usually occur somewhere between 2 and 14 days after exposure. The average time is probably 5 or 6 days. And the most common symptoms are fever, cough, a dry cough usually, and shortness of breath.
Okay. And so as far as a timeline for, we know there's not a vaccine available. Is the health department aware of a timeline of when that could, be developed in the future?
Well, obviously we all hope that we will have one sooner rather than later, but currently we don't have a vaccine, as you stated. However, scientists across the world are working very hard to develop one, and the National Institute of Allergy and Infectious Diseases anticipates that an experimental vaccine would be ready for clinical testing hopefully within a few months. However, even when that enters the initial phase of testing, it would still be some time It'll take time to adequately test the vaccine's efficacy and its safety.
And so, can you talk a bit more about the testing process? Like, how does the testing for this virus work? How does that work if someone were to come in and get checked out for it?
Well, we do not have testing available in local health departments. The Georgia Public Health Lab in Atlanta does provide testing. Some of the commercial labs also, like in this area, LabCorp I know is testing. I understand Quest has begun testing, but that may only be on the West Coast. And currently all testing still must be ordered by a healthcare provider. Someone who's worried can't just walk in and have a test done.
Okay, and I'm just curious, I mean, I know that you guys can't test for it, but like, what does the actual test entail if you're aware of that?
Yes, it's two specimens. One is called a nasopharyngeal swab and one is an oral pharyngeal swab. The pharynx is the back part of your throat basically, and so as the name would imply, the nasopharyngeal swab means you pass a swab or probe through one's nose into the back of the throat. It's not quite as painful as you might think, but it also is not overly comfortable, so it's not something I would just sign up for on a whim. The oral pharyngeal swab just involves going through the mouth to the same area.
Mm-hmm. Another question that I had for you involved, a lot of people have been asking us about the St. Patrick's Day parade and whether or not it'll be canceled, and we're still waiting to learn if it will be, of course, but if the parade does go on as planned, and people do choose to go out, what should they keep in mind as far as being out in crowds on that day?
Well, our public health recommendation on March 17th, and for that matter most any other day of the year, is that anyone who is sick should stay home, and those at increased risk for complications from any respiratory illness, and that would include the elderly, which you can define that as over 60, over 65, or 70, but the elderly seem to be at a little bit increased risk from this virus, and particularly those people who have serious underlying medical conditions like underlying heart disease, underlying lung disease, poorly controlled diabetes, if their immune system is compromised from chemotherapy. And then I would say that if you have both of those things, meaning you're elderly and you have underlying things, I certainly would consider not going. If you do elect to attend, we would say use good common sense and practice good hygiene. Wash your hands, use hand sanitizers, especially after using the restroom or blowing your nose or coughing. If you don't have access to soap and water, again, the hand sanitizers with at least 60% alcohol. Try to avoid touching your eyes, nose, and mouth. That's a good way to introduce viruses or germs into your body. And cover your coughs and sneezes with a tissue and dispose of that properly, then clean your hands. Instead of shaking hands, consider an elbow bump or the foot tap as a way of greeting rather than shaking hands. Don't share cups or other utensils with others. And for goodness sakes, if you get sick while you're out and about, go home.
Absolutely. And so I've seen, in the media that I guess the coronavirus doesn't seem to be impacting children as hard as I guess was previously expected. Are there any reasons as to why this might be?
You're correct that it seems to not be affecting children as significantly as some other age groups, and I can't tell you exactly why. We've had other viruses that seem to particularly target children, or have worse effects in children. This one, for whatever reason, seems to be affecting the elderly more severely than children.
So, it's been said time and time again during this outbreak that, hand washing is the first line of defense, but it never hurts to keep reminding people. So if you could just remind people kind of the correct hand washing techniques that they should be knowing about.
That's a great question, and it's one of those things you can't hear too often. Just, excuse me, just dabbing a little soap on your hands and sticking them under the sink for 2 or 3 seconds might do a little good, but not too much. So moisten your hands, apply a generous amount of soap, scrub your hands together, rub them together, get the backs, interlace your fingers, rub in there, wash down to the base of your thumbs, try to rub and get under your fingernails. Germs love to hide there, maybe even come up to the lower part of your wrists. Should take at least 20 seconds to do this. We're fond of sing happy birthday, the little jingle through twice. If you don't like happy birthday, you can pick your favorite song and sing a verse or two of that. We typically tell people to use warm water, but that's mainly because people will generally leave their hands under the water longer if it's warm than if it's ice cold.
Right. Okay. Another question I had for you is regarding hand sanitizers. It seems that during this outbreak that a lot of disinfectant products are flying off the shelves, including hand sanitizers. So are hand sanitizers actually effective in killing the germs associated with the coronavirus?
Well, the best way to clean your hands is still, like we just mentioned, good old soap and water, particularly if they're soiled and obviously dirty. However, studies have shown that an alcohol-based hand sanitizer that contains at least 60% alcohol is the next best thing. These seem to work better than the non-alcohol based sanitizers. But again, even with the sanitizer, you need to use it properly. So you apply a generous amount, you rub your hands together, you make sure it's everywhere, and you continue to rub your hands and interlace your fingers like you did when you were hand washing until it has dried, evaporated.
Mm-hmm.
So it's not just slap it on and you're good to go. You need to continue to rub until it has evaporated.
Okay. And so if someone thinks that they may have been exposed to the coronavirus, what's the next steps for them as far as what they should do and where they should go?
Well, if you think that you have realistically been exposed to someone with COVID-19, then you should stay at home and preferably away from other people and probably from your pets as well. You would only go outside of your home to seek medical care, but you don't seek medical care without first calling your healthcare provider and alerting them to the fact that you have a realistic chance of having been exposed, letting them know ahead of time before you go, so that they can make arrangements on their end to A, care for you properly, but B, to avoid exposing other people needlessly.
Mm-hmm. And I guess a related question would be, I've seen some people are self-quarantining. Like, what's the proper way to do that to make sure you don't?
Well, we encourage people to identify, if possible, a room in their house, a bedroom in their house where they will stay themselves in a separate bathroom if available. But it's like we've just mentioned, you stay, you don't go out, you encourage your family and friends, not to visit. You don't share personal items such as glasses and dishes and silverware. You wash those things. Use household cleaners to clean commonly touched surfaces like door handles, tabletops, cell phones, keyboards. You clean them appropriately. We don't particularly recommend face masks for most people, but if you're caring for someone who's sick, you know they're sick at home, we would probably encourage the sick person to wear a mask while you're in the room working with them, if possible, unless they have too much trouble breathing. And probably the caregiver would be well advised to wear a mask as well in that situation. And then, of course, the same basic hygiene, good hand washing, use hand sanitizers, keep your house clean.
Right. And something else that I've been seeing on social media is where people are saying that the outbreak is kind of making them feel especially anxious, I suppose. And so for those people, do you have any kind of advice as far as trying to cope with the
Sure.
excessive immediate
Anytime we have an outbreak, and particularly with something that's new that nobody has seen before, it can cause anxiety in adults and children. So if you have an underlying or pre-existing mental health condition, number one, you need to continue your treatment plan with your provider. And number two, do things that help you relax. Don't watch all the news shows and continue to see flashes of sick people or news about the spread. Get out, take a walk, exercise, do yoga, take deep breaths. Just get away from that. Eat a common sense things like eat a healthy diet, maintain your exercise, and again, just try to avoid excess exposure to bad news.
Okay. And someone who's watching right now had a question about the coronavirus. They asked, does the coronavirus act like mono, the way it stays in your body? Like once you have it, are you a carrier? Is that something you can answer?
We think the answer to that is no. This virus, again, is similar to SARS and MERS, which we had in years past. It's a closely related virus, particularly to SARS, and there's no indication that.
And thank you everyone for watching. You can stay up to date on the latest local coronavirus updates, how it's impacting our community by visiting wsav.com/coronavirus. I'm WSAV.com now reporter Ashley Williams. Thank you again for watching.